This is Mushtaq Memon, Professor Emeritus from Washington State University, and I'm also professor here at Chi University. And I'm here to attend 26th International Annual Conference in Traditional Chinese Veterinary Medicine. And the Chi University has outstanding faculty members who contribute in so many different ways. And today I'm privileged to have Dr. Shiau with me, and he's an associate professor of the graduate education here at Chi University. And he advises and mentors graduate students who are doing masters, many of them, and now they're starting PhD program. The really important aspect of research. And myself gone through masters and PhD program, I came to realize that regardless how much scientific and veterinary knowledge I have, but if I don't think about research properly, then I lose the whole concept of research. So many times what happens is that a person like me, clinician, I have some bright idea and I would like to investigate XYZ problem. And I said, okay, I will have, 10 dogs and I will just do XYZ and it'll happen. And once I get the results, come to find out that's not big enough sample or doesn't have any control. So it's not publishable. So I have asked Dr. Shiau to please give us some 2 or 3 pointers what our veterinarian, especially our clinician, whether they are graduate students or those veterinarians who are in practice or thinking to do research, what they need to know. Maybe top 3 points would be good enough, please.
Okay. Thank you very much, Dr. Memon, for the opportunity for me to talk about a little bit about the research, because I'm honored to work with many veterinarians at Chi University here. They are pursuing a master's degree, and one of the requirements they have to do clinical research and to write the thesis and hopefully the published papers. So based on the I was talking with Dr. Memon earlier, many of you and also my students at the beginning, they also have this fear about the statistics when they are thinking about the research. So I try to use this opportunity to talk about what are the main ideas about research, and what do you need to think about the first at the beginning. So research takes a lot of effort and time, resources. So we don't want to waste all this just by doing the research wrong. So what we need to do first is to think about what's your research questions. So what do you are trying to determine from your study? So that's the first step. And based on these questions you will try to answer, then you will have a hypothesis. So we call it study hypothesis. For example, your study hypothesis may be this new treatment you are trying to determine or try to demonstrate this new treatment is better than a current standard treatment, or simply just a procedure, the placebo treatment. So this will determine how you design the study. Okay, so once you have this, then what will be what kind of the study design would enable us to generate the publishable data and results. So there are two main key elements. One, we want your outcome is not affected by the other unknown factors other than the treatment you're trying to test. In other words, we call it in statistics, this is a confounding factor. So we don't want the outcome could be confounded by other factors. So that's why the gold standard you heard commonly is the randomized control study. So we try to randomize your subject, your patients, into the test group and the control group, so that we know the other many factors, they are balanced between the groups you try to compare. So now, so that the outcome, the group difference we will observe from the data, we're more confident than their difference must from the difference of the treatment, not from other else. Okay, this is the first. We don't want we don't want the outcome can be confounded by other factors. The second point is has to be unbiased. So unbiased means your data is not correct in a way that could favor your study hypothesis, right? So this that in order to avoid this, so you heard a lot of study they try to do the the blinded design. So which means especially for the people who collect the data should be blinded to the group to the treatment group each patient is assigned to, so that the outcome is not in favor to each. So the data you collect or the person who collect the data will not be biased to the treatment that you're trying to test. So these are the two key points: the unconfounded and unbiased study design. So that's why you're blinded randomized control study. So this is a gold standard when you try to, especially when you try to demonstrate a new treatment that is more effective than the placebo or the existing conventional treatment. Okay, so these are two main keys you will try to focus when we design the study. And the final point is when you are thinking about of the study, once you have all these basic concept, the fundamental concept, and you want to consult with a statistician who have more knowledge about this, who not only can verify your designs to see everything is unconfounded and unbiased, but also can give you recommendations how, and also determine the sample size, how many patients you need to have a sufficient power to test the hypothesis. So these are the basic points when we are first at the beginning thinking about the research. We have a basic idea. Not only is to make sure we are not acting the effort, but also when you work with the statistician, you have a better idea, a better communication with he or him or her when collaborating on the project. That's all I have to say now.
Thank you very
Hopefully
much.
this is helpful.
It's excellent information. I think trying to summarize this whole big statistics in about few 3 minutes. I appreciate very much.
Yeah. So
Thank you.
one final question
Okay.
is don't be afraid of statistics when you're trying to study. It's basically just a system consistent of the experimental design, the study design, and data analysis. It's nothing complicated than any of the medical system you are studying or have been studying. So it's just a system well established, well accepted by the scientific community, so that they can accept your results. So there's no point to afraid when you try to conduct a study.
Yeah. It's just many of us who are a student of biology or medical sciences,
Yeah.
some of us have these barriers, mental barriers. We think I don't want to deal with numbers. But the thing is that if I want to understand more, I read research papers.
Right.
So just to understand the research paper, what is p-value, what this one is, I need to have some basic understanding.
Right, because that's the common language we as a scientist, the researcher will agree on to adjust to evaluate if the outcome is meaningful.
Yeah, I'm so glad there are people like you around we can come and get assistance from.
I'm very honored to be able to have the opportunity to talk about this and also work with veterinarian Dr. Memon and all of you.
Thank you very much
Thank you.
again. Yeah, bye-bye.
Bye-bye.